Dr. Puri, you can start now from the start, beginning.
Hello.
Hello.
Am I speaking to Mr. Asim?
Yes, doctor.
May I confirm your age?
I'm 27 years old, doctor.
Okay. Mr. Asim, I'm one of the doctor in this tummy clinic, and my name is Dr. Kuratinan Chai. We'll be talking about your medical health condition, and we'll be addressing your concerns. Will that be okay to you?
Yes, doctor, sure.
Okay. Do you have any idea, Mr. Asim, that why this meeting has been called upon?
Doctor, actually, I was waiting for a long time because
Mhm.
everybody is playing with me, and for last 4 months, I have a problem in my tummy, and nobody is taking me serious. And someone is doing some blood tests, and sometimes is throwing me to other clinic, and nobody know what is going on with me. I'm so distressed from your medical profession now, from doctors. They don't understand what's going on with me and what happened at the top. Last week I came to your clinic and your consultant was there. He started me some mood medicine. That's, enough is enough now, doctor. Can you tell me what's going on with me, doctor? Do you think I'm a mad?
I highly appreciate the concerns you have, Mr. Asim. First of all, I want to reassure you that you are not mad, and the worries you have are all valid regarding your health condition. Actually, you have been suffering from this tummy pain and loose stool for the past 4 months, and
Yes, doctor. You're right.
today we have the results of all the tests which were being done of yours. Am I clear to you?
Yes, doctor, you are very clear, and I'm listening you very carefully. But my main concern is that why you don't want to do some more tests, some scan of my tummy to be sure what's going. Maybe I have some, sinister cause in my tummy. I'm very afraid.
Uh, Mr. Asim, I highly appreciate the concerns you have, but almost all the tests which were related to the condition you have been suffering from has been done, and the results are here, and they all are normal, and no any organic cause, no any problem has been found so far.
So, doctor, you are thinking that I'm pretending, I'm making my symptom by my own?
No, uh, I appreciate the concerns you have, but the conditions with which you have been suffering from is known as inflammatory bowel syndrome, inflammatory bowel syndrome, and it is basically, don't bother about the medical jargon. It is basically, uh, would you like me to to draw something for you
Yes, doctor, better to
so
draw
that
for
you
me
could have a
because,
better understanding of people?
yes, it's good. Then why you want to draw for me? Everything is normal. All tests are normal according to you. And by the way, doctor, why you are not going to do some camera test or some other scans of my tummy? Maybe
All
I have
of the
something
tests,
serious more than that.
all of all of the tests has been done, Mr. Asim. So, Mr.
So,
Asim, this is your stomach. This is your food pipe, and this is your stomach where the food stores, and this is your gut. And this is your brain. So what happens that when a person's have this gut becomes so sensitive in this disease, what happens that the gut becomes sensitive, and whatever the food you intake or you swallow into your tummy, the signals which comes from your brain to propels this food or to move this food in forward direction will be in faster as compared to the other people. Are you getting my point?
yes, doctor, I'm getting you. Then, okay. What next, doctor?
So what happens here that the sensitivity of the or your gut, your tummy become more than the other people, and whatever you eat, that will going to result in these symptoms with which you have been suffering from.
Oh, doctor, I have changed my lifestyle. I have done everything. I have changed my diet. I have changed my life, but nothing is working at all.
I appreciate the concerns you have,
How
but
can you
Mr.
say this is
Asim,
a problem related to my brain? Do you think I'm a mad? You are talking the similar things which your senior has done. He gave me some medicine known as abilitriptyline. I went through the internet. I have found that it's medicine for the mood, and the mood doctors are prescribing this medicine for the people who is mad. Do you think I'm mad?
I appreciate the concerns and worries you have, but be sure that you are not mad. But and the drug which was being prescribed to you was in a lower dose. Yes, it is an antipsychotic drug, but yeah, it is also used. Every drug has multiple purpose, and this drug also has multiple purpose. So it has been also used for for the symptoms you have been suffering from. And these symptoms usually happens when the person have some stressors, some worries, some anxiety going on, or priorly patient have some infection that triggers these symptoms to happen. Am I clear to you?
Yes, doctor, you are very clear, but I have nothing in my life. I don't have any stressor. I am a football team captain, and I am having a very happy life. I have two children, my wife. My life is very happy.
Sometimes
Why stress I have?
sometimes it happens that, Mr. Azim, your worries are valid. Sometimes it happens that our brain senses signals more than the usual, and the absorption of your food, the tummy will going to have more symptoms and in a more faster way than usual. So that's why you are having some this undigested food and tummy pain for the past 4 months. Am I clear to you?
Yes, doctor, you are clear, but I need to do more scans because I'm very afraid I'm something very serious.
So, Mr. Asim, almost all of the scans and things has been done, and every test is normal, and be clear that there is no other problem is going on in your tummy.
So, doctor, you are not going to do anything, and how you are going to treat me now? If you have no
You,
symptoms, no problems, and you didn't find anything, then how you will treat me now, and how I'll get better? 2 minutes left.
yes, your concerns are valid. We are going to involve the mood doctors that will going to increase the dose of the medications or change the medications, but be assured that these medication will be in lower doses so that they will not have any other side effects that the antipsychotics drugs used to have, and will give you some social support, will provide you psychotherapy, so that and will also involve the dietitian to provide you the proper diet so that triggers can be noted down, and things can be normalized. um, am I clear?
Yes, doctor, you are clear so far, but how can I be sure that this will work? Because I'm suffering from last 4 months.
This will going to work if we will show compliance with your medications, and proper follow-ups will be there, and your symptoms will be monitored accordingly. Okay.
Okay, doctor.
Okay. So, Mr. Asim, may I ask some few questions from you?
Yes, yes, doctor, you can ask.
What do you do for a living?
I told you that I'm a football player.
All right. And do you smoke?
No,
All right. And do you drink?
no.
Okay. So, Mr. Asim, we're going to provide you some leaflets and brochure, and we'll provide you website links so that you could have clear knowledge about the symptoms you have been suffering from. Uh, am I clear?
Yes, yes, doctor.
Do you have any other concern?
No, doctor. Thank you, but I think I need to keep follow up with you because this condition is not getting better at all.
Oh, thank you.
Time up, Dr. Kurat. Time up. Very well done. Dr. Kurat, you have tried your best and you have very strong grip on this category. So, what is the category of this scenario, Ms. Kurat?
Functional diseases. Explanation
Functional
of functional
disorder.
disease.
You're right. So, what kind of scenarios we can face in exam? This one is IBS.
Other
The
is
second,
conversion disorder, malingering,
malingering, lower limb weakness, and what else? Fibromyalgia. Okay.
and
So,
chronic fatigue syndrome.
chronic fatigue syndrome. You are absolutely right. So, you are always see this scenario when you're in exam. So the patient is very aggressive. This will be written in your uh, question, scenario. This is the last thing which they write. Your patient is aggressive. You talk to him and address his concern. So you did very well, Dr. Kurat, but there is a few things need to modify. Okay. You gave the information, let me draw for you, but before you need to establish the connection between the brain and gut by your words, how it's happening. Okay. And what is the disorder is. So you started immediately draw. That's a good, wonderful thing that you didn't forget to draw. But before that, I was thinking that you will give me information and how you give this news to the surrogate in a well structured way that he will accept your everything, whatever you're going to talk about him. Okay.
Okay.
That's wonderful. You did cover everything. My, hidden agendas I was expecting from the candidate in this scenario. The candidate must explain the disease in a structured manner. The second thing, he should draw. Okay. The third thing, he should mention the possible triggers of this disease. Okay. And he should give a better management plan. So these four things I was expecting from you, and you covered everything. But I think it's my personal opinion that when we are dealing with the functional neurological disorders, we need to give the initial information in a different way so that the surrogate will calm down. Okay. Because you can face the concern. Do you think I need more scans? Do you think that what is about my tummy? What about my loose stools? What's going on with me? Everyone is throwing me like a football. I have a lot of visits to the hospitals. Nobody taking care about me. Nobody's bothering about me. I am not sure you guys are doctors or not. So I am unable to live a happy life with my family. I am socially isolated because of this problem. What's going on with me? I highly appreciate your concern. Okay. So you can start like this. Hello, my name is Dr. Kurat Shahid. I'm one of the doctors today in this facility. Am I talking with Mr. Asim, 27 years old? Yes, doctor. So we are here to discuss with you about your health condition. Is that okay with you? Yes, doctor. Do you want anyone else to attend this meeting? This is optional, actually. This is not mandatory. This question is optional. No, doctor, you can talk to me. Can you tell me, Mr. Asam, how much you know so far about your health condition? And he will start bursting here. He will give you a tough time immediately. Just listen, absorb. Then when he stops, that I can see that you are in problem. I can see that you are suffering. I can see you're frustrated because of this problem. This must be a difficult time for you, Mr. Asim, but be sure that I'm here to help you and support you. Okay. So, Mr. Asim, as you have mentioned that you have this problem and that problem. Okay. And for that, we have done your scans and we have figured out the cause of your problem. So you need to figure out, you need to mention over here, we have figured out your problem. Dr. Kurat, are you getting me now? and you have a condition which affecting the functions of your brain and tummy. It's not a structure, not an organic disease. Your every scan, every test is normal. This is a very good thing that you don't have any structural problem. This can come up normal. You have a problem that affecting the function of your brain and your tummy. Do you have any idea about that? And it is called IBS, irritable bowel syndrome. Do you have you ever heard about that? No, doctor. Do you want me to explain to you? Yes, doctor. Let me draw for you. Okay. So it's time to draw. So here is the brain and here is the tummy. And when there is a some kind of problems, some kind of triggers, then the brain sends messages to the tummy, and tummy here is the muscles, and they are moving, they are having contraction and relaxation, and that can cause the problem similar to your condition. It can cause a tummy pain, it can cause loose stools, it can cause sickness. Are you getting me? Yes, doctor. Yes, yes. You're right. These are the problem I'm facing. So as I have mentioned, this problem is caused by the oversensitivity of the certain stimuli like stress, anxiety, recent trauma, like traumatic life event, whatever, leading to your body interpreting as a tummy pain, diarrhea, and this and that. And can you tell me, is there anything specific in your case? You have mentioned a lot of triggers, Dr. Kurat, and I told you that I don't have anything. So if you ask early, I wonders and I am interested to know if there is any trigger in your case, and he will give you the clue. He is having some stressor or not. His how his life is. Okay. Then anything you have done that was wonderful, and ask the triggers if any in your case, any possibility of such things, and maybe surrogate will open up with you that is a problem with the home, job, social life. And don't worry about that, Mr. Asim, we are not going to let you alone. We have a very good management plan for you. Okay, we will not going to admit you, we will give you social psychological support, and we have very good nursing care. Okay, and there is some talking, relaxing therapy, coping strategies, pacing and graded exercise to improve your body, your problems. Okay, and moreover we're going to involve the brain doctor. And why that the brain doctor to keep you calm and to keep you relaxed in this regard. But doctor, why the doctor gave me a medicine? Do you think I'm a mad? I don't have any brain problem. I highly appreciate your concern. And these medicines are not only for the mood problem. This medicine can be used in a problem when there is some overactivity of their brain, and which can leading to a problem similar to your condition. So our senior gave to the medicine to control your tummy pain rather than your brain disorder. How that sounds to you? Is that make sense to you, Mr. Asim? So address is concerned, you address it very well. And you mentioned that this medicine is affecting on the gut also, and along with the brain. So it's not mood medicine. It's always also treating such conditions similar to your problem. So this is what, how can we deal with any problem if you face somatoform disorders and functional disorders, whatever the category you named it. But in this way, you can deal this category. Wonderful, Dr. Kurat. I was thinking I will give you a tough surrogate, but you escaped today. Very nice. Do you have any question, Dr. Kurat?
No, sir. Thank you so much.
Thank you so much for taking this case. Dr. Sadman and Dr. Shoaib, there is any query, any concern regarding this category?
No, no, thank you.
No.
So today we have covered almost three categories in a different way, and these are the most frequent categories nowadays coming in PACES exam. So be vigilant, go through these recordings I will share in this group today. So you should uh, basically, how to tackle the surrogate in this all categories is very difficult, and very this is a task how to deal with the functional disorder always. I hope you will understand, you will open up. Your opening is very important in all these three categories, how you are going to open your case with the surrogate. This is very important. If in a usual way, then surrogate will give you very tough time. If you are well prepared about this category, so you know how to escape from this situation, you have every answer of any concerns.